Hi, I'm Lyn Cole, and I am an oxygen user 24/7. Maybe very low flow while sitting here without activity. The minute I start increase activity, I'm an extremely high flow user if I really do hard exertion, medium flow user if I walk like a normal person. And
What kind of flows?
okay, sitting here, I'm on 2.5 liters, which is sort of a low flow. And then if I get up to walk, I'll need 3 liters. If I want to do any cooking or cleaning, I need 4 to 6 liters. If I walk down the hall, I need 8 to 10 liters. That's walking around 2.5 miles an hour. It's a tourist walk. And then if I really want to go over 3 miles an hour, I need 12 liters. If I want to do 4 miles an hour, I need 15, 16 liters. If I go uphill, for example, at high altitude, I needed 24 liters per minute for 200 feet. Then I could turn it down to go downhill to 15 liters. So it's variable. I constantly have to use an oximeter, which I recommend everyone else do. So you know what your oxygen saturations are so that you keep yourself at a safe level. All the doctors will say 90 to 92%. I want to be normal. I want to be at least 94%. So my brain is working well.
If you're on oxygen, and have been on since what year?
2003, I was diagnosed 24/7, use oxygen.
12 to 13 years roughly
Right.
on oxygen. How come you're not wearing it?
But I am wearing it.
But I don't see it.
Well, I'm very good. It's hidden now. Normally I let it just hang out. I have transtracheal oxygen. Usually it's fastened with a little chain, and some people have gold chains made. I find a shoelace very comfortable, and you can color coordinate it with your outfit. So it's red today. I have fun with it. Some people put a lot of jewelry on it. Some people use scarves. Some people will only wear a turtleneck, which in the winter is very comfortable. I do that. And all the tubes and everything are hidden, and people don't even know I'm on the oxygen, just like John said. But even when I have it hanging out and showing, the tube showing, even with a V-neck, they don't notice it, because when you talk to someone, you look at their face, and they don't notice it. But that wasn't the reason I did it. The reason was, since I need these variable flows, I kind of liked using a small portable, and with a small portable, it's less weight to carry. And I was needing more, so I thought, I don't want to use those big portables. I want to maintain the ones I have, so I said, literally, slit my throat, because that's what it takes, a little teeny tiny incision.
Does it hurt?
It doesn't hurt. Well, you're sort of sleepy and out of it when they do it. It's an overnight procedure, and you don't feel that at all. And when I came to, I had no pain. They did in the hospital for the overnight give me some painkillers, but when I came home, I did not use them except at night because I wanted a restful sleep. Evidently there aren't, or there are very few nerve endings in that location in your neck. From the incision inside where they build a tract, I have the fast tract method. You might have, some people have the sensation of a sore throat, but I didn't even have that. And it was so perfect, and all of a sudden I didn't have any work of breathing at all because the oxygen was right there in my, they call it the trachea or the windpipe. It was right there feeding my lungs without having to breathe in or anything. It's just there.
Did you, Lyn, feel, because I've heard this from other patients, a rather immediate difference or effect of the catheter?
Oh, well, I was in total denial about, I didn't mind the cannula at all. I was in total denial, but the minute I got home and I looked in the mirror, it was, oh wow, I think I really didn't like that very much. This is neat. There's no more nose sores, no more ears being pulled off. The tubing goes down under your clothing and is clipped on, so if by accident somebody pulls it, it pulls your shirt or your trouser edge. It was just, I got my face back. You become alive again. And I'm not the only one to say this. I have a transtracheal, a small group that answers questions for new people. And every single one of them felt the same way. It was, wow, I have my face back. And some of the ladies would say, I can use makeup again. And that's just a side benefit. Yes, there's some cosmetic benefit to it. But the man who developed the fast-tracked method, it was not cosmetic. It was because it was a superior oxygen delivery. And he did ultimately change over to doing cosmetic surgery because it was paid a lot more than Medicare, which does pay for this transtracheal procedure. Just an overnight in the hospital. You go home, you have your own portable tank, and you're off. Whereas the older method, the modified Seldinger method, is that's you have a holding tube in your neck for a week and then you get your oxygen. It does a good job, it's helpful, but the newer fast-track method is more beneficial. It doesn't close up as fast if it happens to slip out the first month. You have to be really careful of not losing it.
Can we talk for a second about, and I think we both called this, but the yuck factor?
Oh, I met a lady with a super yuck factor the other day, and she should have known better because she was working around older people. And I said, oh, well, I have a transtracheal. And she pulled back and said, oh, yuck. I said, you just said the yuck factor. I said, why is that? Oh, because I'm just so squeamish about every little thing, scratches or needles or anything. So a certain number of people are squeamish. I find men to be less squeamish. They're, oh, that's really neat. And yes, sometimes they're thinking of the cosmetic factor because they're still going to business. But that just isn't it. It's all about the oxygen delivery. It cut my flow needs in half, literally, at night, in half. I dropped from 3 down to, well, not quite half, 1 3/4 liters at night. I do have sleep apnea. I would interrupt my sleep about 18 times an hour. And recently, I asked my doctor, can't we do a night test again? I've raised my nighttime flow level, well, to 2, but I'm going to put it at 2.5. Can we do a nighttime sleep test? And it came back with the most gratifying answer. It said on 2.5 liters, I maintained oxygen saturation level at 95% the entire night, and I didn't have one sleep apnea episode at all, which meant no more using a CPAP or BiPAP in the machine to force air into my body to keep me from dropping saturation. A lot of people have sleep apnea.
What about day-to-day care and feeding of the catheter? Is it a big deal, not a big deal, easy, hard?
Do you brush your teeth?
Every day.
Okay, morning and night. You can clean self in place, this little scoop, you might call it a scoop. And what gave me the yuck factor at first was the idea of putting a wire rod down into my, into this little tube. Oh my God, but then, well, you never touch your innards. It's all in a plastic tube. You don't feel it at all. So you do that 3 times a day, big deal. Some people, the ones that are not as recommended, that are copious mucus makers, might have to do it 4 times a day. They might have to actually change it out morning and night. But I get away with, I'm sort of a dry cough and all, I get away with changing it once a week if I remember.
Now, you're a Kaiser patient. Kaiser has been involved with TTO from the very, very earliest days.
Yes.
And Dr. Bates is your physician. Did you have a easy or difficult time getting Kaiser?
Kaiser wanted to do the old modified Seldinger method, and my push, I did have someone helping advocate for me, was that by the time I got to the hospital, the Seldinger method would have closed up if I happened to lose it at night and couldn't get it back in myself, being that it was a brand new thing. Sometimes you have difficulty. The patient doesn't get to learn how to do it themselves until 3 or 4 weeks.
Okay.
And so I said, I want this other method so I'll at least get to help soon enough to have it reinserted without having to wait to get the operation done again.
If there were 10 patients, sort of equalized lung disease in the waiting room of a pulmonologist's office, any pulmonologist's office, and the 10 had heard about transtracheal, but of course none of them had committed yet, 10 equally qualified candidates, how many of them do you think would actually take that next step and the next step to eventually end up with a transtracheal catheter?
Well, I would say it's really not cosmetic because I don't know many of those patients that would opt to have surgery in their neck and to have a tube inserted just for cosmetic reasons. This cosmetic idea is, in my opinion, a cop-out by the doctors and RTs. No disrespect to them. It means extra time on their part to learn a new procedure and to teach the patients, because at first you need help.
Do you think that transtracheal oxygen should be at least on the list of options that the pulmonologist offers his or her patients?
Oh, definitely. My first pulmonologist offered it to me. He said, would you like to try transtracheal? And that was within a half a year of being on using 2 to 3, the standard 2 to 3 liters, until I found out I needed a heck of a lot more to benefit.
Right. So in terms of your overall quality of life, you just moved to this very pretty place, and
I keep my oxygen saturation at normal level. Why should I suffer? And I compete in events with normal people. I'm a lot slower. I'm 77 for pity's sakes. But in some cases, in my early 70s, I would place first, second, third, or fourth. Of course, that meant there were 1, 2, or 3 others competing against me, and they were doing the full marathon. I was only doing a half.
The combination of transtracheal oxygen and pulmonary rehab is a pretty powerful combination. I can't remember if you either did rehab before or after.
I did rehab before. I was
Okay.
diagnosed in 2003. My friend said, oh, you can do half marathons, blah, blah, blah. And so I rehabbed. I was really in bad shape. In 2 years it took me to rehab.
Okay.
And then it was a transtracheal that made the difference for me to really move out.
And I know you know this. There are a lot of patients who want to do at least some water kind of therapy, or not really swim, but get in the pool.
Yeah, I've been called Tugboat Annie because I take my big high flow tank in a water cooler. It's in your Coke or your beer, and the little side cups around it. And I just tow it right behind me on a 7-foot tubing, and it floats around my feet. I can swim any stroke you want. I can do aquasize. I could scuba dive if I wanted to. I would not. There's something about you don't want to go underwater because of the pressure.
But water doesn't.
Water,
squeak
mine
in or-
closed up so snugly, actually, I had to have it dilated a little bit. Now, that's another advantage of the fast track, because I think the modified Seldinger generally, you correct me, doesn't close up as tightly and snugly as this one. Not a drop gets in. I can lie back in the bathtub with the water several inches over my neck, and not a drop gets in.
And I don't think many patients know that.
No, they don't. They say, how can I swim? Well, you can swim on a long tube and have it on the side, but I like it going. Like to be able to go all the way around the pool without someone pulling on my long tube. You know, it's within 7 feet of me. I just jerk that little thing over next to me. No, you can't play on this. You don't want to tip it over. They all know.
Let's talk for a minute about hospitalizations. And I know it's hard to go back and think before and after, because before was way long ago now. But, you know, since your transtracheal catheter is placed, have you been admitted for?
I've never been admitted to the hospital except once where they were telling me I was having heart problems and I knew what it was. I had to burp. And it was pressurizing there and they wouldn't believe me.
Yeah. So not for pneumonia,
No,
not for bronchitis?
No
not
lung
for...
issues at all, ever, since transtracheal.
That is rather amazing.
Yeah.
You know, if we look at other patients, both your age and time on oxygen.
Well, I was considered mild, borderline moderate in the beginning because of the ratio.
Mm-hmm.
My ratio was between around 53%. So, and now I've dropped down to 47%, and it's very distressing. But I'm still much more fortunate than many.
You and I both know large numbers of the community who are on oxygen. We go to quite a number of meetings together. And yet you may be usually the only transtracheal patient in a room with 15 or 20 people, maybe 10 on oxygen.
There's where I was really lucky. At my Better Breathers and Rehab group, there were four of them with transtracheal, so I saw it firsthand. And I saw the benefits and was amazed, and that's why I was, let's face it, if you meet someone with one, you learn about it. And I try to get it all over. I should also mention that I live at above mile high altitude, so that does make me need higher levels of oxygen. If I was at sea level, I'd only need maybe 2 liters.
Right.
And if I did a half marathon, I'd need 10 possibly. That's going over 3 miles an hour, 4 miles an hour.
What do you think, if you could distill down everything Dr. Petty taught all of us, what did you get from Dr. Tom?
Dr. Tom was very curious about my transtracheal because he was playing around with it in his mind. He believed in it. He thought it was great, but having lived through something like 4 surgeries for cancer and all spine, all sorts of troublesome things, he really, even a little tiny operation, he wasn't really keen on it. He wanted to know for sure how beneficial it was. And I told him, but before he had an opportunity to do it, then he got hit with another problem. And he had polymyalgia rheumatica, which is high prednisone use. My husband has it. And so he was very curious, and he believed in it for other people, but for himself, he had a yuck factor. Maybe.
He actually mentioned that
or,
to me. Yeah.
Oh, he did? Okay, so he just was, but he would take his cannula off on telephone calls because he didn't like the sound. And why he didn't use continuous, I don't know. But
right.
And that is the other tremendous benefit of this. You are not tempted to take the cannula off your nose to eat because you see it and it gets in the way. You are not tempted to take it off because you're meeting and greeting other people or getting your photograph taken. You're just getting it 24/7. And if you want to run around naked, yes, you can. You just clip it to a belt around your waist and at home, I hope.
Right.
Don't go streaking anywhere.
Okay, so let's try to tie this up with 2 questions.
You can cut that one out.
2 questions. One is there any way, educationally, I guess it would be, to minimize at least the yuck factor?
That's a really, really tough one. I think meeting someone else. I am open to getting phone calls from anywhere if someone wants to talk to a person using transtracheal. We have a support group that it's very quiet. It's not like the yakety yak type things. It's if you go in and ask a question, you'll have some 40, 45 people ready to jump in and help you because they're all different varieties. We're all different snowflakes. And they're from all across the country.
Okay, one more question.
Some do that.
Yes, I know. And there's nothing like direct contact.
But you do need to be computer literate.
finally, you certainly are an atypical patient in so many ways. But how would a patient sitting across the desk from their pulmonologist, who has not yet mentioned TTO as an option, they'll talk about lung transplant before they talk about transtracheal oxygen. How should a patient who's done his or her research bring the topic up to the doctor?
I really had a tremendous amount of fun recently. I attended the ATS, American Thoracic Society. Lots of pulmonologists there. And on the vendor floor where I was looking at all the new things that are coming out, I would casually bump into a doctor. "Oh, you're an MD." I said, "What do you think of transtracheal oxygen?" And so many of them, some did, Costa Rica, he didn't know what it was. And others would, well, one of them even suggested you get infections. And I just looked him square in the eye and I said, "And you don't get infections when you use a cannula?" It shut them down. And so I educated them to, I haven't had, maybe I had one infection. I wasn't even sure about it. I did get infected for pierced ears, but not with this. So it's all up to the individual. Same with the cannula. Keep it clean. Keep your hands clean. Wash your hands. And you minimize infections.
What do you think the average nasal, you were one,
Yeah.
when nasal cannula patients, whether it's to take the family picture, like you said,
always
you
take it
gave
off.
good examples. How bad do you think, and we'll use the current buzzword, adherence, is with the nasal cannula? Because you already said you're always getting your oxygen, and you're absolutely right. But for those patients who still more or less suffer with the nasal cannula, 1 hour a day, 1 or 2 hours a day. Remember, Dr. Petty found 6 hours a day in his study.
Yeah. I'm not sure of the question. Would you?
I'm wondering the difference. I know you're getting oxygen every second of every minute of every hour.
Oh,
'Cause
when I had the cannula,
Yeah.
how often? Oh, I would take it off to eat because I hated seeing this tube in the way. I would take it off for photographs. I got used to it after a while. It just took me a week. And I just thought, well, I don't mind it. My husband said he doesn't mind it. My mother did say, "Oh, you look awful, you look dreadful." However, I asked her, checking the Yuck Factor, I asked her, "Okay, Mom," I didn't visit her until I had transtracheal. I said, "Which is better, the cannula across the face or this?" And she says, "Oh, well, I think that's better." So that's from a very squeamish person. It's too amazing for words. It's just, I just love it. And so many, all in the group, the 45 of us will do anything to not give up the transtracheal. Lung transplant patients have to give it up. And then when they find they need oxygen again, they want it and they can't have it because they are really, really fearful, and their doctors wouldn't treat them if they resumed transtracheal. So those are the only ones that can't have it. Some people lose it and they don't get it reinserted because they're so dreadfully sick that they're, I don't know anyone who didn't have it redone.
So no amount of money, nothing could entice you to go back to nasal cannula?
Oh, Lord, no. And it's not the cosmetic. It's the confidence you have in yourself. It's you can do everything normally if you watch your saturation level. If you keep your brain, like if I go out in a car, I insist on having at least 95% because I want to make the correct decisions and have a good reaction. When you go below 94%, you're starting to dumb down and lose visual eyesight. That's why pilots must use extra oxygen. They want them to see the instruments. They want them to see the coming airplane. They want them to make good decisions. And I want to be there too. And I don't know one physician who would cut himself back if you ask them.
Okay, so let's have a, let's say we're at the Dr. Tom meeting and you're on the panel, and finally you're given the opportunity to talk about the difference transtracheal oxygen has made to the large group. As you know, how 150 or so people. Look at the camera and tell us what you would tell the group.
Well, I did do that. And they faked me out by turning the light off so I couldn't see my notes, and I had to do it off the cuff.
We'll do it again. What would you tell them?
So I told them that this is the most amazing procedure. If you want to get your life back, you get your face back. You have great oxygenation. You can use probably a lower flow. Some pulmonary fibrosis don't benefit in the decrease, or restrictive people in the decrease in oxygen, but they do benefit in the work of breathing, that we call it WOB. They don't have to work to breathe. They just feel so much better. And some people still are slow to be self-advocates. You must, I just try to drill that in, be a self-advocate. Ask your doctor, what, why not transtracheal? Oh, infections, you tell them. And I've been getting infections with my cannula. You know, what's the difference? You have to keep your hands clean. I just advocated they try to stay as normal as possible and use this thing for all it's worth. The more hours I read somewhere that they said if you use oxygen 18 hours a day or something, you benefit. Well, it's been proven, I can't find the article right now, then all day you extend your life by as much as maybe 2 years. To me, 2 years is a good thing. 2 years of a quality of life, a good quality, an exceptional quality of life, or at least in comparison to what you're at now.
Thank you, Ms. Cole. Beautiful description. Love it. Love the word for word coming straight from you, because you've walked the walk and talked the talk.
Since 2006.
Since 2006.
9 years.
9 years now.